A 71-year-old woman sat across from me in my office last Tuesday, and before I could even ask what brought her in, she started crying. Not from pain, not from a diagnosis, but from relief. She told me she had spent 3 years thinking something was deeply wrong with her because she no longer felt like the person she was at 40. Her energy had changed, her body had changed. Her relationship with her husband of 44 years had shifted in ways she could not explain. And she was terrified to talk about any of it. She assumed aging meant accepting loss, accepting less, accepting silence. But that morning, she finally asked me the question she had been holding inside for years. She asked if it was normal to still want closeness, connection, and physical affection at her age. And when I told her yes, absolutely yes, that tears came. Because nobody had ever told her that before. I share that story because I know you might be feeling something similar right now. Maybe you clicked on this video because you have been wondering the same things she was wondering. Maybe your body does not respond the way it used to. Maybe your relationship feels different. Maybe you have lost a partner and do not know if you will ever feel that kind of connection again. Maybe you wake up tired, go to bed tired, and spend most of your days wondering if this is just what getting older looks like. And if any of that sounds familiar, I want you to hear me clearly. You are not broken, you are not finished, and you are not alone. What I want to share with you today comes from decades of working with adults in their 60s, 70s, and 80s. These are men and women who came to me confused, embarrassed, or discouraged, and who left with a completely different understanding of what this stage of life can actually be. Because here is the truth that rarely gets talked about in mainstream health conversations. Aging does not have to mean decline. It does not have to mean giving up on closeness, energy, or joy. And there are specific daily habits that separate those who struggle through these years from those who thrive through them. This is not about miracle supplements or extreme fitness programs. This is about small, practical patterns of living that stack up over time and create real results. If your daily life already includes these 5 habits, you are quite literally beating the odds. And if it does not, you now have a clear path forward. Let me start with the first habit, and it might surprise you because it has nothing to do with exercise or diet. The first habit that sets apart healthy, thriving adults between 63 and 83 is open. Honest communication about how they feel. I do not just mean telling your doctor about your symptoms. I mean telling your partner, your family, or even yourself the truth about what is happening inside you emotionally. After decades of marriage, many couples fall into a pattern of assuming. You assume your partner knows how you feel. You assume they understand why you have been distant. You assume they are not interested in physical closeness anymore, so you stop initiating. And they are making the exact same assumptions about you. This silent guessing game creates a gap that widens year after year, and before long, you are sharing a home with someone who feels like a stranger. I worked with a couple in their late 60s, Gerald and Marion, who had not been physically close in over 5 years. When I asked them about it, Gerald looked at the floor and said he assumed Marion did not want that anymore. Marion looked shocked. She said she had been waiting for him to show interest. Both of them had been sitting in the same house, longing for the same thing but too afraid or too proud to say it out loud. That conversation changed their marriage. Not because I gave them a pill or a procedure, but because I gave them permission to talk. And when they finally did, they realized they still wanted each other. They just needed to learn a new way to communicate about it. This matters even if you are single. Honest self-reflection about your emotional needs, your fears, and your hopes is the foundation for everything else. You cannot address loneliness if you refuse to admit you are lonely. You cannot work through grief if you keep insisting you are fine. And you cannot reclaim your sense of vitality if you are pretending you do not miss it. Adults who thrive in this stage of life are the ones who talk. They talk to their doctors, they talk to their partners, they talk to their friends. And most importantly, they talk to themselves with honesty and compassion. This brings me to the second habit, which is maintaining consistent, meaningful physical movement. Notice I did not say intense exercise. I did not say running marathons or lifting heavy weights. I said meaningful movement, the kind that fits your body as it is right now, not the body you had 30 years ago. Movement does something remarkable for adults over 60. It supports heart health, which becomes increasingly important as we age. It helps regulate hormones that affect mood, sleep, and yes, even desire. It keeps joints flexible, muscles strong, and balance steady. And it creates a sense of accomplishment that directly counters the feeling of decline that so many people carry. But here is where people get stuck. They remember what exercise used to look like for them. They remember running 5 miles, playing competitive sports, or spending an hour at the gym. And when they cannot do that anymore, they assume they cannot do anything. So they stop moving altogether. The adults who beat the aging odds do not fall into that trap. They adapt, they walk daily, even if it is just around the block. They stretch in the morning, they take water aerobics classes, they garden. They dance in their living room. They find movement that brings joy instead of punishment, and they do it consistently. Not perfectly, not every single day without fail, but regularly enough that it becomes part of who they are. Movement also directly affects intimacy. When your body feels capable and alive, you feel more comfortable in your own skin. Blood circulation improves, which matters for physical function in both men and women. Energy levels rise, and the confidence that comes from caring for yourself radiates outward in ways that strengthen every relationship you have. For men dealing with prostate concerns or cardiovascular issues, gentle, consistent exercise has been shown in study after study to support better outcomes. For women navigating the changes that come after menopause, weight-bearing movement helps protect bone density while reducing the intensity of symptoms like fatigue and mood swings. Movement is not optional at this age, it is medicine. The third habit might be the one people resist most, but it is absolutely essential. Adults who thrive between 63 and 83 prioritize sleep and take active steps to protect it. I cannot tell you how many patients have told me they just do not sleep like they used to. And they say it with a shrug, as if this is just something they have to accept. But poor sleep is not a natural consequence of aging. It is often a sign of something that can be addressed. Whether that is hormonal shifts, medication side effects, untreated anxiety, sleep apnea, or simply poor sleep habits that have built up over the years. Sleep is when your body repairs itself. It is when your brain consolidates memories and clears out waste. It is when hormones rebalance and stress levels come down. Without quality sleep, everything else suffers, your mood becomes fragile. Your patience disappears, your immune system weakens. And your relationships feel the strain. Here is what I tell my patients. Start treating sleep like an appointment you cannot cancel. Go to bed at the same time each night, wake up at the same time each morning. Make your bedroom dark, cool, and quiet. Limit screens for at least an hour before you try to sleep. Avoid alcohol close to bedtime because even though it might help you fall asleep, it destroys sleep quality later in the night. If you have been waking up multiple times to use the bathroom, talk to your doctor. For men, this could be related to prostate changes. For women, it could be related to bladder function or hormonal shifts. These are treatable concerns, not things you simply have to live with. And if your mind races when you lie down, if you find yourself replaying the day or worrying about tomorrow, consider that this might be anxiety or depression that deserves attention. Mental health does not become less important as we age, it becomes more important. The losses pile up, friends pass away, health scares shake us, children move far away. These are real emotional burdens, and ignoring them does not make them lighter. Sleep is connected to everything: your heart, your brain, your hormones, your relationships. Protect it fiercely. Now let me talk about the fourth habit, and this one requires courage. Adults who thrive in these years are proactive about their health. They do not wait until something is seriously wrong to see a doctor. They do not avoid screenings because they are afraid of what might be found. They do not stop taking medications because they do not like the side effects without first talking to their physician about alternatives. Proactive health management means scheduling regular checkups even when you feel fine. It means being honest with your doctor about everything, including topics that feel embarrassing. It means asking questions about your medications, especially regarding how they might affect energy, mood, weight, or intimacy. Many common medications prescribed to adults over 60 have significant effects on physical function and desire. Blood pressure medications, antidepressants, antihistamines, medications for prostate issues, even pain relievers can all create changes that patients often attribute to aging rather than to the pills they are taking. If something has shifted since you started a new medication, bring it up. There may be alternatives, dosages can sometimes be adjusted. You deserve to feel like yourself. This habit also means not ignoring symptoms. Persistent fatigue, unexplained weight loss, changes in urination. Pain during physical closeness, bleeding that should not be happening. None of these should be brushed off as just getting old. Your body communicates with you, and ignoring those signals does not make them go away. I had a patient named Franklin who waited nearly 2 years to tell me about discomfort he was experiencing. He was embarrassed, he thought it was just part of aging. By the time he finally mentioned it, we discovered a condition that would have been much easier to treat if he had come in earlier. He recovered well, thankfully, but he told me afterward that he wished someone had given him permission to ask for help sooner. Consider this that permission. Being proactive also means understanding that chronic conditions do not have to end closeness. Arthritis, diabetes, heart disease, these are challenges, yes, but they are not barriers to connection. They require adaptation. They might mean finding different positions that put less strain on joints. They might mean timing intimacy for when energy levels are highest. They might mean using more time for emotional closeness when physical closeness is difficult. But they do not mean giving up. I have seen couples in their 80s maintain deeply fulfilling intimate lives because they refuse to accept the myth that age ends affection. They worked with their doctors, they communicated with each other, they got creative. And they proved that connection has no expiration date. The fifth habit ties everything else together, and it is perhaps the most important. Adults who beat the aging odds nurture closeness, both emotional and physical, as a daily practice. Closeness is not something that just happens in long-term relationships. After 20, 30, or 40 years together, it requires intention. The spark does not stay lit on its own, you have to tend to it. This means small gestures that might seem insignificant but are actually everything. Holding hands while watching television, saying thank you for ordinary things. Asking about your partner's day and actually listening to the answer. Offering a hug for no reason, sharing a laugh. These tiny moments of connection are the glue that holds relationships together through the difficult seasons. For couples who have experienced a long period of distance, rebuilding closeness takes time and patience. You might feel awkward at first, you might feel like strangers trying to remember how to be close. That is normal. Start small, start with presence. Put away the distractions and simply be in the same room together, talking, laughing. Remembering why you chose each other in the first place. Physical closeness does not have to mean one specific act. It can be cuddling, massage, kissing, dancing together, or simply falling asleep with your hand on your partner's shoulder. For many adults in this age range, expanding the definition of intimacy opens doors that felt permanently closed. When you remove the pressure to perform and replace it with the freedom to connect, everything changes. For those who have experienced loss, I want to speak directly to you. Grief after losing a long-term partner is one of the most profound experiences a person can go through. There is no timeline for healing, there is no right way to grieve. And there is absolutely no shame in eventually wanting connection again. Some widows and widowers feel guilty about dating or about desiring companionship. They feel like it somehow dishonors the person they lost. But wanting to love and be loved is not a betrayal. It is a sign that your heart is still alive, still capable, still human. If you are considering dating again after loss, go slowly. Be honest with potential partners about where you are emotionally. Do not feel pressured to meet anyone else's timeline. And know that it is okay to feel conflicted. It is okay to miss your late spouse deeply while also hoping for new connection. These feelings can exist together without contradiction. The same is true for those who find themselves single after divorce later in life. You might be navigating intimacy and dating for the first time in decades. The world has changed since you were last single, but the core principles remain the same. Be honest, be kind, be patient with yourself and others. And do not let fear of rejection keep you isolated. Loneliness is a serious health concern for adults in this age range. It has been linked to heart disease, cognitive decline, depression, and shortened lifespan. Nurturing closeness, whether romantic or platonic, is not a luxury. It is a necessity for your health. Now I want to address something that many people find difficult to discuss, which is how the body changes with age and how those changes affect everything we have been talking about. For women, the years following menopause bring significant shifts. Estrogen levels drop, which can lead to changes in vaginal tissue that make physical closeness uncomfortable or even painful. Lubrication decreases, skin becomes thinner and more sensitive. These are not signs that something is wrong. They are normal biological changes that millions of women experience. The good news is that solutions exist. Over-the-counter lubricants can make a meaningful difference. Vaginal moisturizers used regularly can help restore comfort. For some women, prescription estrogen therapy, either systemic or topical, might be appropriate after discussing risks and benefits with a doctor. No one should suffer in silence with these concerns. Help is available. For men, testosterone levels gradually decline starting in the 30s and continuing throughout life. This can affect energy, mood, muscle mass, and sexual function. Erections may become less firm or less frequent. Recovery time between encounters lengthens. These changes can feel alarming if you're not expecting them, but they are part of normal aging. Prostate health also plays a significant role. An enlarged prostate, which is extremely common in men over 60, can cause urinary symptoms that disrupt sleep and affect quality of life. It can also create concerns about sexual function. Open conversations with a urologist or primary care doctor can clarify what is happening and what options exist. Medications for erectile difficulties have helped many men, but they are not right for everyone, especially those with certain heart conditions. Never take these medications without a doctor's guidance. And remember that physical function is only one part of intimacy. Emotional presence, attentiveness, and affection matter just as much, often more. For both men and women, body image concerns intensify with age, weight shifts. Skin changes, mobility decreases. It is easy to look in the mirror and feel disconnected from the person staring back. But here is something I have learned after years of working with adults in this stage of life. Confidence matters far more than appearance. The people who continue to experience fulfilling closeness are not the ones with perfect bodies. They are the ones who accept themselves, flaws and all, and show up fully for their partners. Your body has carried you through decades of life. It has worked, loved, cared for others, experienced joy and pain, and brought you to this moment. It deserves gratitude, not criticism. Treating yourself with kindness is not vanity. It is the foundation for everything else. I also want to acknowledge the mental health aspects of this stage of life. Depression and anxiety do not disappear after a certain age. In fact, they often increase due to isolation, health concerns, loss of independence, and grief. These conditions directly affect energy, desire, and the ability to connect with others. If you have been feeling persistently sad, hopeless, or disconnected, please talk to someone. This could be your doctor, a therapist, a counselor, or a trusted friend. There is no weakness in asking for help. Mental health treatment at any age can restore quality of life in ways that feel almost miraculous to those who have been struggling silently. Stress also takes a tremendous toll. Many adults in this age range are caregivers, either for spouses with declining health or for aging parents. The demands are relentless, the exhaustion is real. And there is often little time left for self-care or for nurturing your own relationships. If this is your situation, please hear me. You cannot pour from an empty cup. Finding even small moments for rest, for pleasure, for connection with people who fill you up rather than drain you. This is not selfish. It is necessary. Caregiver burnout destroys health. Ask for help. Accept help when it is offered, and remember that taking care of yourself makes you more capable of caring for others. Let me bring all of this together now. The 5 habits I have described: honest communication, meaningful movement, quality sleep, proactive health management, and nurturing closeness are not separate strategies. They are interconnected parts of a whole, each one supports the others. When you communicate openly, your relationships improve, which reduces stress, which improves sleep. When you move your body, your energy rises, which makes closeness more possible, which deepens connection. When you manage your health proactively, you catch problems early, which preserves function, which allows you to continue the activities that bring you joy. This is not about perfection. No one does all of these things perfectly every day. This is about patterns, about general directions, about small choices that accumulate over time into significant differences in how you feel, how you relate to others, and how you experience this stage of life. If you're watching this and feeling like you have a long way to go, please do not be discouraged. Every positive change, no matter how small, moves you in the right direction. You could start tonight by having an honest conversation with your partner about something you have been avoiding. You could start tomorrow by walking around the block. You could call your doctor this week to schedule a checkup you have been putting off. And if you are watching this and feeling alone, whether because you have lost a partner or because you never had one, or because your relationship feels empty despite sharing a home with someone, I want you to know that isolation is not your destiny. Connection is possible at any age. It requires courage, yes. It requires vulnerability, but the rewards are worth it. The woman I mentioned at the beginning of this video, the one who sat in my office and cried, she came back 6 months later. She was a different person, not because her body had changed, but because her understanding had changed. She had started talking to her husband again, really talking. They had found new ways to be close that worked for their bodies as they are now. She was sleeping better, she was walking every morning. And most importantly, she had stopped believing the lie that aging meant the end of joy. That is available to you too, not a return to who you were at 40, but something even better. A version of yourself who has earned wisdom through experience. Who knows what matters? Who refuses to settle for less than genuine connection and genuine health? The years between 63 and 83 can be some of the richest years of your life. Not in spite of the challenges, but often because of them. The urgency to live fully, to love deeply, to not waste time on what does not matter, that urgency becomes clearer with age. Use it. Let it motivate you to make the changes you have been putting off, to have the conversations you have been avoiding, to ask for the help you have been too proud to accept. You are not finished, your story is still being written. And the habits you choose today will determine what the next chapter looks like. I have seen patients in their 80s holding hands with partners they adore. Active hands that still work, still touch, still communicate love. I have seen widowers in their 70s find love again and describe it as deeper and more meaningful than anything they experienced before. I have seen people transform their health in their 60s and 70s through consistent small changes that added up to extraordinary results. This is possible for you, but it requires you to believe it is possible. It requires you to reject the cultural messages that tell you to quietly fade away. It requires you to claim your right to health, to closeness, to joy. So take what you have learned here today and put it into practice. Talk to your partner tonight, move your body tomorrow, schedule that appointment. Guard your sleep, and never, ever believe that this stage of life is about settling for less. You deserve more, and you are fully capable of getting it. Thank you for trusting me with your time. Take care of yourself. You matter more than you know.